Hi, I'm Zong La. I am the director of the International Craniofacial Institute in Dallas, Texas. I've been here for nearing on a decade now, and I'm here today to talk with you a little bit about some nuances for these incomplete cleft lip repairs. Now, with any of these repair techniques, it's key to pick out the landmarks that you need to line up from the beginning to the very end of the surgery. You have to keep track of these landmarks, or else you're going to be very unsatisfied with the repair when you see them back a year later. So these are standard marks as per Dr. Fisher and Nordhoff, with the white roll, the depth of the white roll at the red line, and the base of the nasal sill. Now, where people get a little bit tripped up is trying to figure out, okay, how am I going to find Nordhoff's point? So what I'm looking at there is where the dry vermilion, that part between the red line and the white roll, how tall is that? How far are we from the oral commissures? And then also, where is there good quality white roll? Very, very key in defining how continuous that upper lip looks is going to be that reflection, that white roll. It's a highlight. It's something that your eye catches very naturally. And so you want to make sure you have a good quality white roll so there's no interruption, and that it follows a nice curve across that scar so that you don't draw any unwanted attention to it. Now, the other spot that gets I'd say people confused or hesitant or worked up is this top point at the nasal sill and into the nasal floor. So especially with incomplete clefts, you have to be very careful not to base the cleft side nostril on the non-cleft side. Why is that? Well, when we bring the lip together and the columella straightens up, it makes that non-cleft nostril bigger. And so if you try to make the cleft side the size of the original nostril, you're going to end up with, some people call it like a micro nostril. It's going to be smaller. It's going to be exactly what you were going for, and it's going to be too small. And so the key here is you leave the sill in place. You figure out how big the nostril is once you've repaired the columella and the muscle, and then you'll be much happier with that nostril. The other thing that I'm looking at is the height of the lip, and then people get confused about that cutaneous triangle. Just leave all that extra skin. You can measure it, you can decide this is where I want to put it, but then at the very end, just leave yourself that extra skin. So when the muscle comes together, then you can decide, is this actually where I want to cut the skin, or is that actually, did I leave not enough, too much? You can tailor that. You can use your judgment and your artistic vision and kind of what you're seeing on the table to guide the surgery.